Thank you for joining us today on Breaking Down the Barriers on KZI 88.7. I'm your host, Beverly Reeves. Breaking Down the Barriers is an initiative of the Austin Independent School District. This program was created to provide resources, programs, and district initiatives to support AISD families in preparing each and every student to be successful. Today's guests are Tracy Spinner, the Assistant Director of Student Health Services, and Ms. Michelle Rusnick, our Supervisor of Health and Physical Education. Thank you both for joining us today. So Tracy, tell us a little bit about yourself and how long you've been with the district.
Thanks, Beverly. I have been with the district 13 years in the position as the Assistant Director of Comprehensive Health Services. And in my office are our Student Health Services team, so all of our nurses and our Vision and Hearing department, as well as we also are responsible for first aid and CPR and AED training for all of our staff. And this year I had the very fortunate opportunity to also bring on mental health and behavioral health services under my direction.
Okay, that's a lot going on with health in school districts. A lot of people didn't know that we had all of that going on.
We offer a lot of resources and services for families that many community members and families in our district don't fully understand that we have these opportunities. Everything from comprehensive healthcare services within the school setting to family resource centers where parents can access resources and information around jobs, English language learning, housing resources, and basic needs services such as food and shelter.
That's great. So Michelle, your work ties really closely into what Tracy does. Tell us a little bit about yourself.
Well, I've been in the district for 26 years.
Wow.
I taught 13 years as an elementary physical educator and got the privilege of interviewing for this position and getting it. And so now I am over all the health and physical education, K-12, and then also something called coordinated school health and our adapted PE teachers as well.
Okay. So let's talk about, basically how physical education impacts learning.
Well, physical education is something that we need every day, right? Everybody knows it as just going out and working out or being active throughout the week. So physical education is very important for our students. They need to have the same thing as we try to strive as adults. So in physical education, we don't only just provide the physical activity, we provide the education piece, and that's where the concepts and the values come in. And we hope that what we're teaching is a lot of fun, skill development, social development, and that they can take it into a lifelong learning.
Right. So Tracy, how does that tie into the comprehensive health services that you provide?
So Michelle and I work very closely together. So we have a saying in our office that if you don't take care of your body, where will you live? And that's important to remember as, growing up through school and then becoming an adult and going out into the, college career, workforce and beyond. And so we work very closely together to really support the whole child. So from physical education through nutrition, teaching knowledge, skills in the classroom, through applying those out in the community, in their neighborhoods, and then also through staff, and employee wellness, being able to support employees in their roles, whether on campus, out in our service units, our warehouse, central office administration, but being able to strive and really share that message of whole child, whole person wellness through our district.
So a lot of people who may not have children in school assume that physical education is like it was when we were in school,
Right.
dodgeball or just recess. Have things changed?
Things have changed a lot. We, at the elementary level, well, first of all, there's no more dodgeball.
Okay.
Let's just get that straight.
little
We
dangerous.
should not have dodgeball. And But what we really do is we focus on skill development, but we also bring in, like Tracy was saying, all the concepts. So you have to know the why to really value it and understand it. So every unit that we teach, there's also a wellness piece that goes along with it. And one of the things that Tracy and I are so good about is this whole coordinated school health effect. And so whatever they're learning in PE, we hope that it extends back into the classroom as well. Or even we work with our food service folks sometimes too. I'm sure a lot of our elementary parents out there know the words go slow and whoa, because that's how we identify certain foods, and our cafeteria folks are helping us with that as well. So
Okay.
kids are seeing this whole coordinated effect.
That's great. So how can parents help us as a district impart these, what the students are learning in school?
You know, we hear this every year right before testing. You hear, get more sleep, eat a healthy breakfast, make sure you're physically active during the day. These are not concepts that are just reserved for testing time. It really is something that should be instilled in them all the time. So get 8 hours of sleep at night. Limit screen time. So limit video games, limit TV watching time. Be physically active, at least 60 minutes a day of physical activity. And that can be broken up during, 20 minutes in the morning, 20 minutes during the day, 30 minutes, 40 minutes after school. So, being physically active, eating a healthy, balanced meal, everything in moderation, and then also making sure that they're mentally well and taking care of stress management, anxiety. So these are things that should happen all the time, not just during testing season.
So do we have to follow a curriculum for these things, or do teachers come up with their plans on their own as far as?
We have a really robust curriculum, and a lot of people, I think, don't realize that. And it's an aligned curriculum from kinder all the way through high school.
Okay.
And so what we do is we not only teach our kids, but there's knowledge assessments as well. We have district-wide assessments. A lot of times PE, like you said earlier, PE was this when I grew up. But we actually write the curriculum in the same format as language arts and social studies and
Okay.
science and math. And so we're held to the same standard of high-level questioning, the differentiation, all the instructional practices. So we're hoping that you see that in the physical education gyms and in the health classrooms as well.
And from health services, the nurses, when a student is going to the nurse's office, and if they're a frequent flyer in the nurse's office for things like headaches, tummy aches, we're reinforcing those messages that they're learning in physical education and health education. So we're asking the questions. What did you eat for breakfast today? Did you have a healthy breakfast? Did you even eat breakfast this morning? And being able to, reinforce and support the messages and the knowledge that they're learning in the classroom.
So let's continue the conversation about nurses. So AISD staffs employs nurses, and they're at every campus. Tell me about how that works.
So we are very fortunate that we've had a 20-year partnership with Seton Family Healthcare and Dell Children's Medical Center. So all of our nurses on campus, and there are full-time nurses on all of our high school campuses, and then we have full-time health service team between a RN and a health assistant at the middle school level. And then at the elementary level, we have many, many campuses that have a full-time healthcare team between an RN and a health assistant. And then we have some campuses that have less than 40 hours, but more than 30 hours a week of healthcare. So there are always a healthcare team presence on the campus. And those nurses are, working comprehensive, everything from acute illness injury care to case management of chronic conditions such as asthma, diabetes. If a child has a food allergy or an anaphylactic response to, such as an ant bite or a bee sting, et cetera. So it's comprehensive health.
Okay.
And one thing people may not realize as well is one of the laws is to make sure that all physical educators are CPR certified and first aid as well. So
Okay.
if there was a nurse missing for some reason because they're traveling, the school is still covered.
Oh, that's good to know. That's good to know. You mentioned also earlier, Tracy, about mental health services, and this sounds new. Is this something that the district has always provided for students?
This is relatively new for not only our district, but education in general. When we generally think about an education institution, we think about the focus on academics and really your, neck up. What Austin ISD has done is we've really focused on the whole child. Everything from universally, meaning for everybody, social emotional learning, through campus-based mental health services, which is what we are providing through my office. This began back in 2012 at Crockett High School, where we staffed a full-time licensed counselor, licensed therapist, to see students as patients. And students were referred, to them with parental consent to look at their mental health and wellness. And now we are up to 18 campuses in the district where students who are referred by their parents can see a mental health professional during the school day for everything from stress to anxiety, depression, schizophrenia, all the way to bipolar disorder or conditions that are dual diagnosis, so anxiety, depression, schizophrenia, bipolar. But what we're seeing is a drastic change in stigma in the district. So you, in the community, you hear people say that there's a stigma around mental health, that we don't want to talk about it. And we're really seeing that culture shift within the district where we do want to talk about it.
That's good.
And we're supporting students on campuses during the day where they are, in addition to supporting families on their community school campuses around mental health services.
Okay, that's good. So Tracy, before you were talking about mental health services provided on AISD campuses, but there were only 18 campuses covered. Can you talk to us about how the other campuses might receive services?
So any campus can refer students to any of the 18 locations, and parents can find those locations by visiting our website at www.austinisd.org/health, and they can click on the link, and it is titled Campus-Based Counseling Referral Centers, and there is the full list with contact information and phone numbers for all of our locations if they would like to have their child be seen by one of our therapists, or they could simply call my office at 512-414-9778, and I'd be happy to help them locate the nearest campus in which they can be seen by a therapist. And we are open during the summer months. So June, July, and August, we are open and providing services to families and students. And or I can also help them with a community resource. So if they would like to see a therapist in the community for an evaluation, I can certainly help connect them to resources in the community.
Okay, that's great to know. And you talked about stigma also, trying to take the stigma away from mental health. And I think this is a good start because a lot of times students especially will talk negatively about mental health, or even some families don't believe in mental health. It might be against their culture or something. So it's good that we're providing services in the schools that may not be as visible to the outside community, where they can get services while they're on campus.
We're also training teachers on trauma-informed care. So many of our children come to us with challenges that they have experienced growing up, such things as parental incarceration, violence in their communities, abuse at home, And when children grow up with these challenges, they may not show signs and symptoms immediately, but it will ultimately affect their behaviors in the classroom and really their academic performance and their ability to learn if they're carrying these stressors and these negative emotions and feelings with them without an outlet to be able
Right.
to really process what happened and how can they support themselves through learning how to deal with these feelings that they experience. So we're teaching teachers how to support students in the academic environment around trauma. And what we're finding is that it's also triggering teachers who may have experienced trauma growing up that they had, been really pushing down for a very long time. So it's actually helping them as well to become better educators, as well as helping their own mental and emotional well-being. So we're very pleased to be able to offer this service as well on a campus-by-campus effort.
So going back to the teachers, if employees find themselves reliving a traumatic event, is that where employee wellness comes in, or do they go to these same counselors that the students are going to?
Either one. So
Okay.
we have varying resources available to employees in the district. There is our employee assistance program through Human Resources that they can access an external therapist through Alliance Work Partners, or they could reach out to see one of our campus-based therapists. And the same way, they could either call my office or visit the website and find the location that's most convenient for them.
That's great. So Michelle, we mentioned at the break we were going to talk about physical education versus physical activity. So finishing up with mental health, how does that impact, or how can physical activity impact mental health?
Well, it goes back to just basic health practices, right? We need to fuel our bodies. We need to move. We're beings that need to move. And so, of course, physical activity is always promoted every day. The physical activity piece, I think, is extremely important because it is a stress outlet. And we do need to provide that opportunity for our kids, not only at the elementary level, but at our secondary level. So therefore, it gets into our physical education pieces, but we're also offering at the middle and the high school levels open gym sometimes during before school or after school. Some of the weight rooms are open up, and I know that happens for sure for the athletes during the summertime. I know a lot of our middle schools are starting to do some intramurals during advisory, and I even think a couple of them are starting to have more opportunities at lunchtime to get outside and move. So something else that I think is really important that the public should know is at the elementary level, we've partnered with Marathon Kids. And so this year was the first year that we had a huge district initiative for all of our elementary kids to try to run 4 marathons over the entire school year. And so we're just getting our preliminary data back in, but we know that probably 100% of them, I can't say 100%, but most of them definitely did 1 and 2 were, we kind of tail down a little bit around 3, but in the 4th marathon, and every marathon that they complete, they get a reward from Nike and Marathon Kids. So that's been a big, big program to help with our cardiovascular endurance for our kids. And then something else that we're doing at the elementary level is we use GoNoodle.com. And parents can sign up for it, and I encourage them to do it, especially with little guys. That's something that's free, and if they just, once you log in, they can click on Austin ISD, and the kids can use some of the same brain breaks that we do during the classroom that the teachers provide. And it's, we like you said, 30 minutes a day is very, very important for adults. 60 minutes a day is even more important for kids. So if parents get out, role model, support, encourage, make it a routine part of their summer, set that expectation at the beginning, then hopefully kids will maintain their fitness and their health throughout the summer.
I think you've used some of those Go Noodle brain breaks on us before, Michelle.
Just a few.
So yeah, now it's all coming together for me. So you talked about parents working with their students and modeling activity and things. Are there anything else parents can do to support health, physical activity, those kinds of things, especially during the summer and now when students really want to be at home and play video games, they want to be outdoors. I remember growing up, we were outside all the time.
Right.
And the thing was, you just have to be home before the lights came on.
Yeah.
And now it's like everybody's in somebody's house playing video games or they're on their phones.
Well, it's interesting because Tracy and I are both now moms, and so getting to say it one way and then being a mom and reality kind of sets in, or a parent. And so I think it goes back to what I said earlier, setting those expectations at the beginning of the summer of this is what we will be doing as a family, and being a part of it and just making sure it's fun. Austin it has tons of activities to do, and so there's great things to go and explore and be active. The trails are a lot of fun. But I think it comes down to eating a healthy meal to fuel your body so that you have that fuel to exercise a little bit. Keep that sleep routine. You know, a lot of times it's summer, so we don't have to follow that routine, but keeping that sleep pattern is really important. Like Tracy said earlier, making sure that the screen time stays at a set amount of time and just maintaining. I'm sure you have.
Yeah, and simple things, parents can do during the summer, create a checklist. I know probably the second day of summer, my daughter, who is 8, will say, "Mommy, I'm bored." And so, have a checklist of things that she can do and, have a plan of activities, everything from reading, making sure she's keeping up with her reading during the summer, have some reading time every day, to being physically active. And the Austin Parks and Rec has some amazing summer programs. Calling 311, parents can access community resources for where, students can have, free places, free fun things to do in Austin that can be found on that website. But like Michelle said, just staying active, keeping up with the routines, and making sure that, they're being sun safe when they're out in the sun, because Texas sun is intense and hot during the summer. So staying hydrated, wearing your sunscreen, and just having a really great summer.
What a perfect opportunity to get to play as a family.
Sure. Are there any things that we might not have covered through this interview that you wanted to share with the audience?
Just a reminder, immunizations. In Texas, it is a requirement that students have their shots before they can come back to school in August. So if your child will need an immunization in order to attend school in August, they will get a letter beginning in May with a list of what shot that they will need. And then there will be a list of resources and locations around the community, including in the school district, where they can receive their immunization either free or low cost. And then also, checking with their private family physician to make sure that they schedule those appointments before everybody schedules them in August. So getting those appointments scheduled early in the summer can either keep the shot records and bring them back to school in August, or can send them or fax them to my office, 512-414-0035 is my fax number, and I can get those over to their appropriate campuses. But immunizations is important. We want all students to come back to school rested, healthy, ready to learn in August. So we don't want any problems at the beginning of the year because they've not taken care of the immunization during the summer.
Right. Wow, you've provided quite a bit of information with regard to immunizations, mental health, physical education, the requirements, curriculum, basic health services, nurses. I don't know that a lot of folks in our audience actually knew we had nurses, registered nurses in our schools, and that's good to know. Well, that's all the time we have for now. Thank you, Tracy Spinner, our Assistant Director for Coordinated Health Services, and Michelle Rusnick, our Director of Health and PE. Thank you for listening to Breaking Down the Barriers today. To get updates and interesting information about the district and AISD community, like us on Facebook, follow us on Twitter at AISD_BDB, or on Instagram. Also, watch Breaking Down the Barriers on AISD's Channel 22 every Tuesday and Thursday evening at 7:30 p.m. and Sunday mornings at 10:30 a.m. I'm your host, Beverly Reeves, and I look forward to seeing you next time on Breaking Down the Barriers.